What are the after effects of hysterectomy? So this is a very common question that many women will have when we offer them hysterectomy as a permanent cure for their conditions. So the concern that the women will have is what will happen to their fertility, what will happen to their menopause status and the hormones, and how their health is going to be affected after the hysterectomy. So hysterectomy again is a procedure where we are removing the uterus which is supposed to bear the child, and along with this we may sometimes offer to remove the ovaries also in women. So this is offered as a permanent solution in cases of fibroid, prolapse, adenomyosis, endometriosis and gynecological cancers. So the after effects is mainly about two things that we need to discuss. One is the fertility and the second thing is the menopause. So coming to fertility, since uterus is the childbearing organ and we are doing a surgery to remove the uterus, so obviously the fertility will be compromised. That means the woman will not be able to have children after hysterectomy. So this whole portion of the uterus will be removed when we do the procedure of hysterectomy. If along with the hysterectomy, if the ovaries are removed, then they will attain menopause, and that means the hormones which are secreted from the ovaries will not be secreted and it will stop. So this procedure definitely will have some kind of an after effect in the woman, and all this needs to be discussed with the patient or the woman who has come to us for this procedure before we actually go ahead and do the procedure. So after this, again, there could be issues like, is there weight gain? Is the body going to be normal? Is the sex life going to be normal after hysterectomy? So the first one, that is the body, whether it is going to be normal. Yes, the body is definitely going to be normal and she will recover within a few weeks, if it, depending on the type of hysterectomy. If it is an abdominal hysterectomy, then it will take at least 2 weeks to recover. If it is a vaginal hysterectomy, it will take 1 week to 10 days for the recovery. If it is a laparoscopic hysterectomy, it will take less than 1 week for the recovery to happen. So depending on the type of hysterectomy, that is whether it is a total hysterectomy or whether it is a total hysterectomy with the removal of the uterus, the menopause symptoms can happen after the procedure. So the menopause symptoms could be hot flushes, it could be bloating, it could be irritability, mood swings and feeling low, weight gain. All these could be a symptom of menopause, and this has to be again warned to the patient that post hysterectomy that these can happen. So coming to the sex life, since the vagina is not going to be disturbed in cases where we have done the hysterectomy, usually the sex life will be the same as before and there will be no change. So during this recovery period, so the woman may feel slight pain or discomfort in the abdomen, the woman may feel discharge from the vagina. Sometimes there could be bleeding from the vagina. Also, many a times they will feel tired and they will have headache and they will feel that there is no energy left in them. So all this can be managed with medications which we give during the post-operative period. We give them antibiotics post-surgery, and all this can take care of the post-operative symptoms, if at all, if there are any. We usually call them after 1 week to check whether the biopsy report that we have sent, the uterus, so whether it is normal or is there any abnormality in that, as in like any cancerous changes which needs further follow-up. And also we call them again after 4 weeks to check how the healing is. So again, taking care of a woman post hysterectomy is a very important thing till they recover completely from the surgery, as hysterectomy is a major surgery that a woman will undergo. So this can be done either through abdominal, vaginal or a laparoscopic route, and it has to be done under anesthesia, and also it has to be done in the hospital, where the hospital stay could be around 1 to 2 days depending on the procedure that we will be doing. So the after effects, more than the after effects, it is the myths that the woman will be having about hysterectomy that will cause a lot of stress and emotional turmoil for them when they undergo the procedure. There are so many myths that their friends and their relatives will be sharing with them, that the patients will come again and again with so many doubts even before they go ahead with the surgery, and it is our duty as healthcare professional to clear all their doubts before we actually go ahead with the surgery. Ideally, the surgery has to be done, or hysterectomy has to be a chosen form of treatment only after the age of 40. And in rare cases or in special situations where the benefit of doing a hysterectomy outweighs the risk of menopause and fertility in less than 40 years of women, a detailed discussion about the procedure and the after effects should be done with the patient, and then we do the procedure of hysterectomy. So ideally, again, hysterectomy should be offered as a last resort, as a permanent cure for their problem, where all the other methods of treatment fail to give them relief. So hysterectomy again is a commonest condition or commonest surgery that is performed across the world for disorders like fibroids, prolapse, adenomyosis and endometriosis. Thank you.